Hi, my name is Jerry Myers. I'm the chief of the Ridgefield Fire Department. And I'm going to talk for a few minutes about the pandemic of COVID-19 that we had to deal with over these last few months, and we continue to deal with. In particular, how we had to change the way we provide the services we provide and the impact that's had on our members. So first, probably the single largest impact to us has been isolation. We are a very public department. Our doors are open day and night. People wander in and out of the fire station. We talk with people. We meet with people. We go out and do fire prevention and education opportunities. People come in, and all of a sudden, we had to flip a switch, and that stopped. So we're cut off essentially from the general public. And not just externally, but internally. We have 6 firefighters working in this station and 2 firefighters working in the North Station. And suddenly we all couldn't sit in the same room and have a conversation anymore. With the initial social distancing requirements, and it was particularly important for us to make sure that no infection came back to the firehouse and infected our members. So we had to divide ourselves up among different floors and different rooms in the building all day. Community meals where we would have a breakfast or a lunch or a dinner had to stop, and we had to have meals individually or in groups of 2. We had to eliminate visitors from the firehouse. We had to eliminate congregating. We had to stop training initially and meetings to handle the business of the fire department, because the danger was if one person got infected and then worked around the shift that day, he could conceivably infect all 8 people that were on duty that day. And one person could eliminate 25% of our available workforce. And with one case, we could be down to 75% capacity. And if we did that once or twice, we would have had a very serious deficit and a real challenge to provide the service that the people of Ridgefield have come to expect from us. So that was a real challenge for us, and we had to work to find ways to get around that. And online, Zoom was probably the biggest help to us. We were able to start reconnecting on a more regular basis using Zoom and other internet avenues. So one of the things it allowed us to do was bring counselors into the department via Zoom and meet with members and discuss the anxiety and concerns they have related to working in and being exposed to people who were infected with the COVID-19 virus. We were able to have some department business and some connectivity with each other by having online meetings. Not a substitute for in-person, but an improvement over no contact whatsoever. The second thing that affected us was the need for very specialized personal protective equipment. We had to wear, obviously, eye protection, face masks, gloves, some of which we're used to wearing on a regular basis anyway, but some, like the wearing of a Tyvek protective suit, we don't do on a regular basis, and typically only for an hour here or there, a couple times a year during training. But for us, each time we entered a scene where a patient had or was suspected of having the COVID-19 virus, everyone on our team had to wear that equipment, again, to make sure that we were not bringing any infection back to the firehouse. So that was a challenge for us in terms of the uncomfortableness of it. and the movement restriction and the difficulty in caring for people in it, but also in terms of just getting the equipment in the first place. We, as well as the rest of the nation, were challenged initially to find suppliers who could supply us with the numbers of equipment we've needed. We couldn't have anticipated going through hundreds of Tyvek suits in a single month, as we were at the peak of our contacts with patients during this virus. And we did not maintain a extremely high level of personal protective equipment, because the equipment itself will degrade over time. So we have to keep using it and replacing it as we went along. And suddenly we were using it without the ability to replace it. So we had to work hard to find ways to open those supply chains to us, so that we had the equipment necessary to protect ourselves while we were taking care of the community. So that was a challenge for us. We had to change the way we think about cleaning and disinfecting the firehouse. We take pride in the fact that we run a clean station, we keep the place presentable, we take responsibility for what the citizens have provided for us to work out of, and make sure that we treat it like our own. But suddenly it was necessary to be disinfecting the building a minimum of 4 times a day. Plus, the ambulances and engines had to be disinfected after each use, after each time we contacted a patient, again, to prevent exposing ourselves or passing infection from one patient to another patient. So this was also a challenge for us. And on top of that, our folks, our firefighter paramedics, were still taking care of their homes and taking care of their families. Their families were clearly worried about them being exposed to the COVID-19 virus on a daily basis. So there was a fair amount of stress that was placed on the department members. But our department, as it always does, rose to the challenge. We had no members who did not or could not report for work due to COVID-19. We had one member test positive for COVID-19, and in fact probably had some symptoms from the infection and had to stay out of work for a couple of weeks. But it did not impair in any way our ability to deliver 100% of the service we're required to deliver, because other members stepped up to fill that person's spot. So we're proud of the fact that we're the only town agency that operated at 100% through the entire COVID emergency. I think those are the principal ways we were affected. We had to change the way we deliver medicine because the hospitals and doctors' offices changed the way they deliver medicine. Hospital offices didn't want patients who were potentially infected with COVID coming into the offices and contaminating the offices and potentially infecting patients who were at risk, who happened to be in the office at the same time. The hospitals had to guard against becoming so overwhelmed that they were not able to provide basic care. So we had to alter a little bit the way we did business. And in some cases where people originally called us to go to the hospital, when we got there and evaluated the patient, we would call the emergency room and speak to the physician there, and he would, between speaking to us and speaking to the patient, decide if bringing them to the hospital was the best plan, or if there was an alternate plan that could be worked out, like a teleconference with their own personal physician, or ordering of prescription medications, or home self-monitoring in lieu of transport. Likewise, patients who died, when we were called to the scene, where we automatically would have immediately began life-saving measures and transported them to the hospital in the age of COVID, the hospital again asked us to evaluate each situation. And our paramedics are what we call physician extenders. They're an extension of the emergency department. And in a cardiac arrest case, we are capable of delivering the exact same care that a person will receive in the emergency department. So the hospitals asked us to, in these cases, in some cases, to deliver the care for a certain period of time and then reevaluate the patient and speak with the hospital. And if it appeared that the effort was not going to be successful, then we would terminate the effort at the home and let the family make arrangements for disposition of the body without transporting to the hospital and overwhelming the limited hospital resources that were available. So that was a challenge for us. It's not in our nature to abandon a resuscitation effort, but the science and the situation both called for us to use the best possible information and provide the best possible care and recognize when an effort was futile. And again, that was a little adjustment for our staff, and that was just another portion of what we do that added to the stress of the entire situation. But I think one of the things that made it easier for everybody were the constant, nearly daily signs of recognition from the community, from kids sending cards to people going out and banging pots at 7:05 every night to say, hey, we're with you, to the people who dropped off meals for firefighters and the businesses who stepped up and said, hey, we're going to feed you one day a week. This is one less thing you have to worry about. And that's kind of typical of Ridgefield and the sentiment in our community. And it was well received by our staff and certainly contributed to help and to reduce the serious stress that everybody was under working in this. So I think it was a combined effort between our folks and their dedication to duty, the community who stepped up to support us, and the staff of the town and the first selectman who made it clear that whatever we needed to keep our folks safe and to protect the town was available to us. So there was never any question about getting a hold of an extra piece of equipment, an extra pile of supplies or anything. The first selectman and the board of selectmen and the board of fire commissioners were 100% clear that anything that was needed, they supported. So again, that was just another thing that was helpful, both in terms of the care and service we were able to deliver, as well as making the firefighters feel supported, which in turn, again, helped to reduce the significant stress they were under. So overall, as things start to or appear to be winding down with COVID, we're hopeful that there won't be a resurgence, but we're prepared for the possibility that there is. The protocols we've established will carry us through this emergency and potentially for other viruses that are previously unknown that will come along in the days or years to follow. So that's how the fire department and our emergency medical services operated during this time period. And thank you for your time.